Welcome to Studious. Today we are diving deep into one of the most foundational concepts in all of anatomy, directional terminology. If you've ever been confused by the words dorsal and ventral, you are absolutely not alone. These two terms are the backbone of how clinicians, surgeons, and anatomists communicate the precise location of anything on the human body, from a minor skin lesion to a complex spinal injury. Without mastering these terms, reading a clinical note, interpreting an MRI report, or even following a dissection guide becomes a real challenge. In this video, we're going to break it all down, clearly, visually, and with memory tools you won't forget. Whether you're in your first year of medical school or brushing up for an exam, this guide is built specifically for you. Let's get started.
Before we can talk about dorsal and ventral, or any directional term in anatomy, we need to establish one non-negotiable starting point, the standard anatomical position. This is the universal reference frame that every single directional term in medicine is based on, regardless of what position the actual patient is in. Here's what it looks like. The body is standing upright, the gaze is directed straight forward, the arms are hanging down at both sides, the palms are rotated facing forward, and the feet are slightly apart with the toes pointing forward. Here's the critical rule. Even if a patient is lying face down on an operating table or curled up in a hospital bed, all anatomical directions still refer back to this standard position. This is what keeps medical communication consistent and error-free across all disciplines worldwide.
Now let's define the two stars of today's lesson. Dorsal comes from the Latin word dorsum, meaning back. It refers to the backside of the body, the posterior surface. A helpful memory trick? Think of a shark's dorsal fin, which sticks up from the back of the fish. Ventral, on the other hand, comes from the Latin venter, meaning stomach. It refers to the under or abdominal side of the body, the anterior surface. So in simple terms, dorsal equals the back, ventral equals the front or belly side. In most regions of the human body, dorsal and posterior are interchangeable, and ventral and anterior are interchangeable. This pairing is the foundation you will use in almost every anatomy course, clinical description, and imaging report you encounter throughout your medical career.
When we apply dorsal and ventral to the main trunk of the human body, the torso, the rules are beautifully straightforward. Along this primary axis, dorsal strictly and exclusively refers to the posterior plane. That's the back surface, where you find the spine, the erector muscles, the scapulae, and the posterior thoracic wall. Ventral, meanwhile, maps precisely to the anterior plane. That's the front surface, housing the sternum, the abdominal wall, and all the organs of the gut cavity. This clean posterior dorsal and anterior ventral pairing is the default mapping that applies throughout the trunk and most of the limbs. Mastering this simple axis makes it dramatically easier to interpret anatomical diagrams, cross-sectional CT scans, and clinical descriptions. When you see dorsal anywhere near the trunk, think back. When you see ventral, think front.
Here's where things get a little more interesting. The appendages. For the hand, remember that anatomical position requires the palms to be facing forward. Because of this rotation, the palm itself becomes the ventral aspect of the hand. It faces anteriorly. The back of the hand, the side with your knuckles, becomes the dorsal aspect. You've probably heard this already. A dorsal hand vein is the vein on the back of your hand, while the palm side is ventral. Now for the foot, this is a true exception. The human foot lacks a clearly defined ventral aspect. Instead, the top surface of the foot, what you'd call the back of the foot, is strictly called the dorsal aspect. This is why the major artery running over the top of the foot is called the dorsalis pedis artery. Always remember, foot dorsum equals the top.
Let's test your understanding with a real clinical scenario. Imagine a patient comes in with a tattoo, and you need to document its exact location in their medical record. The tattoo is located near the upper inner forearm, close to the elbow on the palm-facing surface. How would you describe this precisely? The correct clinical description would be, the tattoo is located on the proximal end of the right forearm on the ventral aspect. Let's break that down. Proximal means closer to the point of attachment, in this case, closer to the elbow. Ventral aspect refers to the palm-facing anterior surface of the forearm. This is how anatomical language eliminates all ambiguity. Vague descriptions like upper inner arm have no place in clinical documentation, but proximal ventral forearm tells every medical professional exactly where to look, instantly.
Now we enter one of the most fascinating and frequently confusing areas of anatomical terminology: the brain. Neuroanatomy plays by slightly different rules, and understanding why makes all the difference. Let's start with the lower brain regions, specifically the brainstem and the cerebellum. Good news here. In these lower structures, the standard bodily axis applies exactly as you would expect. The ventral aspect of the brainstem corresponds to its anterior surface, the front-facing side. The dorsal aspect corresponds to its posterior surface, the back-facing side. This is consistent with how we described the trunk. So when you hear about ventral tegmental area or dorsal column in a neuroscience lecture down in the brainstem region, you can confidently apply the standard anterior equals ventral, posterior equals dorsal framework without any modification.
Here comes the exception that surprises almost every student. When we move up to the cerebrum, the large, wrinkled upper brain, the directional axis undergoes a 90-degree rotation. Why? Because during human evolution, the neural axis bent forward at the front of the brain. This bend, called the cephalic flexure, means the directional axis of the cerebrum is tilted relative to the rest of the body. The result is this. In the cerebrum, the dorsal aspect no longer means posterior. It means superior, or the top of the brain. And the ventral aspect no longer means anterior. It now means inferior, or the bottom surface of the brain. So when neuroanatomists say dorsal striatum, they mean the upper portion of that structure. And ventral prefrontal cortex means the lower surface. This 90-degree rule is essential for any neuroscience or neurology course.
Let's bring everything together with a complete anatomical compass. For the main torso, ventral equals anterior, the stomach side, and dorsal equals posterior, the back. For the hands, ventral is the palm facing forward, and dorsal is the back of the hand. For the feet, there is no true ventral surface. The top of the foot is the dorsal surface. Moving into the brain, for the brainstem, ventral is anterior, dorsal is posterior, same as the body. But for the cerebrum, the axis shifts 90 degrees. Dorsal becomes superior and ventral becomes inferior. Master these 5 regional mappings and you'll navigate every clinical description, every anatomical diagram, and every cross-sectional imaging report with total confidence. Thank you for watching Studious. If this helped you, please like, subscribe, and share with a fellow med student who needs this. See you in the next lesson.